right, so let's talk about the Moro Reflex. The Moro Reflex is a reflex that we see in young children, and it's usually gone by the time we're 6 months old, but effectively when we have the loss of support. So whenever we have a change in the way they're supported, so if you think about a little, like a neonate, a little baby, one of the ways you can test is just by like puffing the pillow and moving their head. And the main response is that the arms go up. And it's different from a startle reflex in the sense that it's mostly related to postural systems. And God only knows why we do it, but the thought is that it triggers that when we start to fall or we start to tip or we're starting to lose our support, sticking the arms up helps to do one of two things. One, like cling to mom, but also just to be able to reach up, and allows us to be able to have something to grab onto, like if there's a parent there. And that's why they typically seem to dissipate around 6 months old. Obviously we see in some children and in some adults, there's a persistence to that, where we move their head and we get a reflexive movement of the postural muscles. And we see these with problems with the central nervous system regulating output to the spinal cord. So normally those reflexes, the reason that they kind of go away is not that they like dissolve and vanish into the air. It's because as the frontal lobe develops, as the brain myelinates and becomes more dense and kind of turns into a more mature brain, the pathways that come down allow you to be able to inhibit them. So if we lose that functionality or that functionality doesn't develop, then we just don't inhibit it and we see it sneak through, and that's what we look at in these types of reflexes. And they can be signals about what's going on in that central system. A lot of times if a Moro response happens or a startle response happens relative to a head movement, then we want to look at the integration of how the brain is able to process labyrinthine and otolithic information from the vestibular system. And people talk about remediation of reflexes. In these cases, we want to think more about what pathways would be dysfunctional that would cause a lack of inhibition of them. And the other thing to point out is that the difference between the Moro and the startle reflexes is that startle reflexes, obviously, like you can't keep startling someone, so you can't scare someone walking out of a room and have them freak out and then immediately do it again. It doesn't work. So Moro reflexes are repetitive, whereas startle reflexes can attenuate over the course of stimulating. So if you keep tipping your head, they'll stop doing it as much. So just a quick thing to look at. Reflexes that are commonly tested in people, and you can see them all over the internet, but it's helpful to kind of dial into what they actually mean.